morning, everybody, and thank you for joining us for this great workshop that we're holding this morning. We are so fortunate to have such a great group of panelists with us this morning. We have Sal Nessie, who's the Public Health Coordinator from the town of Cromwell. We've got Russ Melmed, who is the Director of the Chatham Health District. And of course, Kevin Elak is the Acting Director of the Health for the City of Middletown. These guys have been our unsung heroes throughout this entire COVID pandemic. I can't thank you guys enough for joining us this morning. We truly appreciate what you've done for us, not only just coming this morning, but really attending every division meeting we have to update our members in our community, and we so appreciate it. I just want to go over a few things about this morning's meeting. So we will do the questions and answers at the end. As you all know, at the bottom of your screen, there's a question and answer function in a chat function. If you have a question or anything in either one of those, please put it in there and I will get to those at the end. For those of you who are calling on the phone, you can send an email to myself. That's johanna@middlesexchamber.com. That's JOHANNA@middlesexchamber.com. Again, I really truly want to thank Kevin, Russ, and Sal. They really have been our unsung heroes, and I can't thank them enough for all you've done for us and the clarity that you've given us as a chamber to lead our business community as well. So I'm going to turn it over to our great leader, Chamber President Larry McHugh, to say a few words as well. Thank you.
Okay, just a quick thank you, Johanna, for the introductions to everyone. Another sincere thanks to Russ, Kevin, and Sal. As Johanna said, they have been unbelievable speaking to our various divisions throughout Middlesex County as we move forward through this crisis we've had to update the business community on the ongoing difficulties that we face. And they've been terrific supporters. So words can't thank them enough for their service to our region and state. Just a couple of things. This is our second workshop this week. We had one on PPP on Monday. We do have a couple coming up next week. We have one with the Connecticut Small Business Development Center on rethinking your business in a post-COVID world. That would be on January 19th. We do have a panel discussion with all our HR directors throughout the county, and that's Wednesday, January 20th on COVID also as we go forward. And then at the end of the month on the 29th, we have our virtual legislative breakfast with all of our different state senators and state representatives. So again, I'll turn this over to our three outstanding health directors in Middlesex County to do this very important workshop today. Thank you again.
Thanks, Larry. Appreciate that. For those of you who don't know me, my name is Russell Melmed. I'm the Director of Health for Chatham Health District. Of the three of us, my role today is just to describe probably what most people are familiar with at this point, which is the disease that we're dealing with, COVID-19, how it spreads, epidemiology, testing, and why we are so concerned about it still. So a little bit about the disease. It's a virus. I think we all know that. It's spread through respiratory droplets. Those are sort of the large particles that come out of our mouth and our nose when we speak, sing, scream, or even just breathe. Those tend to fall to the ground within about 6 feet after they leave our mouth. So that's why everybody hears the 6-foot distance rule, because most of those respiratory droplets just fall in an arc down to the ground. After about 6 feet. So 6 feet is really important. It's also why masks are really important, because they can catch those respiratory droplets before they go anywhere. So spread by respiratory droplets. Very similar to the flu. So why is it so different from the flu? Well, the first thing is influenza is spread most often by people who are most symptomatic. So let me say that again. Flu is most infectious, most contagious when people are sick, actively coughing, sneezing, very sick. That's different than COVID-19, unfortunately. It's what makes it so difficult to control, is because more than 50% of the spread occurs before people are symptomatic or when they're asymptomatic. And roughly 30% of all infections will be completely asymptomatic for the duration of their infection. So people will never get sick, but they are, for those people, they're thought to be at about 75% as infectious, as capable of spreading it to others as when people who later will develop symptoms. So it's really insidious in that way. And I think, at this point, we probably all know people who've had COVID-19 and have no idea where they got it, don't recall being around somebody who was sick. And that's why. It's because people are asymptomatic and they are very, very effective and efficient at spreading the virus. I want to demystify a little bit some of the data you might be seeing and hearing. The two biggest things that we hear about often are, infection rates and percent positivity. An infection rate is simply the number of cases that you have in a period of time divided by the population that you're talking about. So towns will say, take the number of cases you have over the course of a week or 2 weeks and divide it by the number of people who live in that town, and that's your case rate. And that's normalized by multiplying that number. It's just a numerator and a denominator times 100,000. So you'll often hear people say, my town, for example, Portland has 54 cases per 100,000. That's how you calculate that rate. And it's a way we can compare towns of different sizes without saying, well, this town has 500 cases and this town only has 30, so it's safer in this town with only 30. Well, that may not be the case because the rate may be higher. So you can say, well, if this town had this many people in it, there would be more infections. So that's a rate. The percent positivity, right now in Middlesex County, it's somewhere in the area of 7.2%. That's simply the number of tests that we're doing compared to the number of tests that are positive. So again, numerator, denominator, the number of positive tests divided by the number of tests that are done. Another way to think about that is of anybody who is getting tested, for whatever reason, because they're sick, perhaps, that's how many of those people you would expect to have COVID-19. So when there's a 7.2% or a 10% test positivity rate, that means about 1 out of 10 people who have anything going on with them, some kind of illness, it's COVID-19. So at any given time right now in the winter, there are a number of respiratory illnesses that are spreading, influenza, other colds, which are also usually coronaviruses. They're spreading at any given time, but now it looks like there's a lot of coronavirus spreading. So that's how you can interpret that test positivity rate. Why it is so important to stick to only socializing with people in your households. As I mentioned, it's a pretty infectious disease. Roughly one person will give it to about 2.5 other people during the course of their illness. That's more than twice as frequent as influenza, and it's spread very efficiently in families. So, right now we have, for example, around 1 out of every 100 people in the state of Connecticut that you will run into on any given day is infectious with COVID-19. So we have about 3,600 cases per day in the state. That translates to about 1% of the state population over the course of 10 days where it's contagious will be actively spreading the disease. So why should that be scary to anybody? 1% doesn't sound like a lot. Well, over the holidays, what that means is for every household that gets together with another household, if you have 10 people, 1 out of 10 of those gatherings is going to have somebody who has COVID-19. And they're going to give it to about 50% of the people in that household. So that's why we're seeing this surge. So you think that a small gathering of 10 people isn't risky, but in fact it is. There's a 1 in 10 chance that for every small gathering of 10 people, there will be somebody with COVID-19 at that gathering, and they'll give it to between 30 and 50% of all people in that gathering. So that's why we're seeing this surge. That's why it's accelerating. You go to a gathering, you might pick up COVID-19, you bring it to your family, and then 50% of your family is likely to get it from there. So that's kind of how it spreads. That's why it's so difficult to control. You get together with small groups of people, somebody has it, more than likely 1 or 2 people are going to get it at that gathering and bring it home. So how do you find out that you've got COVID-19? Well, either you develop symptoms, and they're often very mild: nasal congestion, a headache, runny, stuffy nose, fever, loss of taste or smell, chills, aches and pains, shortness of breath. You also can get tested. There are 3 kinds of tests. The most sensitive and specific is a PCR test that takes a couple of days to get the results back. Very, very good and accurate test. It looks for the actual RNA of the virus. The other kind of test is very common, are antigen tests. Those are typically the rapid tests you hear about. They're a little bit less sensitive and a little bit less specific than the PCR tests. That just means if you have a negative test with that test, there's a bigger chance that it was wrong if it says negative. But they're very reliable. So if it says positive, you probably got COVID-19. There aren't a lot of false positives. There are some false negatives. So those antigen tests look for little proteins on the surface of the virus itself. So that's Those are the two main tests. The other kind of tests you'll see out there are antibody tests. Those will tell you if you've had a history of infection. Doesn't tell you if you're sick right now. There's not a lot of testing for antibodies going on right now. The state of Connecticut has used antibody testing to look and sort of estimate the percentage of the population that has had COVID-19 over the course of the pandemic. And right now, it looks like between 10 and 15% of the population of Connecticut has had COVID-19. So that's quite a bit. It's quite a few people. But before we reach some level of population level immunity that we can really bring down the pandemic to control it, we need to reach around 70% of the population to either have had natural infection or to get immunity from the vaccine, which Kevin's going to talk about. The other thing that we use to prevent the spread of COVID-19 is isolation and quarantine. If you're sick, you stay home. How long do you stay home for? 10 days after you started with your illness is the general rule of thumb. The day you start with your symptoms is day 0, and you want to stay home for 10 full days after that. So if after 10 days you haven't had a fever for 24 hours and you're starting to feel better, you're no longer thought to be contagious, right? You're not going to spread it to anybody else. A lot of people will have a little bit of a lingering cough, some lingering fatigue, maybe even some lingering shortness of breath. So long as you're improving at that point, you can go about your daily activities. Quarantine is different. That's for people who aren't yet sick, but know they're around somebody with COVID-19. Quarantine right now, the safest option is still 14 days. That's the incubation period of the virus. But what we've learned is that only about 1 out of 10, 1 out of 100 people who are exposed to somebody with COVID-19 and will end up getting sick, it happens in days 11 through 14. So now the state has says, well, in order to increase compliance with quarantine, you can shorten quarantine to 10 days, so long as on days 11 through 14, you continue to monitor yourself for symptoms. So 14 days is the safest, 10 days is acceptable. The third option, which I really would discourage you from using, but which is technically acceptable, is getting a test on day 5. Again, day 0 would be that day you were around somebody with COVID-19. If on day 5 you get a test and it's negative, you can then shorten quarantine to 7 days. So you would quarantine for 7 days, and on day 8, you can discontinue quarantine. The reason I don't like that is because roughly 1 out of every 20 people who ultimately get COVID-19 will test positive or get sick in days 8 through 14, even after a negative test. So that's that residual risk. Those are all acceptable by the state of Connecticut, but I would discourage any of you paying attention to not really go with that test out strategy. I think it's a little bit too risky. But if there's one thing I've found throughout all this work, and I think Sal and Kevin would agree, everybody's personal comfort level with the same risk is different. So we can tell you what the numbers are, we can tell you what the risks are, and one person might think that is unacceptably risky, and another person might think that's no big deal. So it really is up to every individual, but to me, 1 out of 20 is a little bit too high a risk for getting tested negative. Kevin and Sal and I have all had plenty of experiences where people get a negative test on day 5, and then we hear they're sick on day 11 or 12. It happens not infrequently, that 1 in 20 chance. We see it every day. So that's isolation and quarantine in a nutshell. I'll stop rambling and I'll pass it on to Kevin to talk about vaccines.
All right, thanks, Russ. Joanna, I'm going to share my screen. Let me see if I can do this. Can everybody see that? Good, okay, thanks, Russ. So I put together a few slides. I'm going to be talking about the vaccine. Of course, that is the hot topic right now. Ever since it's been over a month now, I believe, since the Pfizer and Mrna vaccines have been given emergency use authorization approval by the FDA. So, and you know, you've been probably, I'm sure, hearing in the news about the vaccine coming into Connecticut and going out to our places like our healthcare facilities and nursing homes. So it's the light at the end of the tunnel, right? We've been dealing with this pandemic now for what seems like it's almost going to be a year. We've been you know, taking the measures to slow down the spread of the virus by, you know, doing the things like Russ mentioned about wearing masks when we're around others, avoiding large gatherings, social distancing. You know, we've had to unfortunately, you know, shut down at times with our schools and our businesses to slow this spread of this virus down. And we're all pretty much sick and tired of this, right? We want to get this pandemic past us. And we now have a couple of very safe and effective vaccines that are available out there that will hopefully put an end to this pandemic. You know, for the foreseeable future, we think that if we can get this vaccine out to enough people that will take the vaccine, that we can have enough what we call herd immunity, that we can at some point in 2021, you know, return to somewhat you know, normal lives and get back to what we were doing before. So let's see. So just a quick kind of, you know, recap, I guess. You know, there are two vaccines that have been approved or emergency use authorization by the Food and Drug Administration. You've probably heard. One is the Mrna Vaccine, and the second one is the Pfizer BioNTech vaccine. First, I'll just talk quickly about the Mrna Vaccine. That one is authorized for use in individuals aged 18 and over. In clinical trials, it's been shown to be 94.1% effective. And to kind of give you a comparison, the average flu vaccine is only about 40 to 60% effective. So just to give you an idea of how effective this, you know, this promising to be for this vaccine. You know, just know that no vaccine is 100% effective. There's always that slight chance, even if you get vaccinated, that you can still get the COVID virus. And that's why we are still telling people that even after you get vaccinated, you should still take the same precautions as we've been doing before with mask wearing and social distancing. For the Mrna vaccine, there are 2 doses required, and those are, you know, again, in clinical trials, it was done 28 days apart. So it's really that about 2 weeks after the second dose is when the full effect of the vaccine will, you know, give you the full immunity. It is what's called a mRNA vaccine, and not to get too much into the science of it, but basically this what's called this messenger RNA. The vaccine has a piece of this mRNA in the vaccine, and this RNA creates a blueprint in your body to help your body create a defense for the against the virus. It does not contain the SARS-CoV-2 virus at all, so you absolutely cannot get the coronavirus from the vaccine itself. You've probably been hearing some people maybe who have gotten the coronavirus, you know, after getting vaccinated, but that's again because you still are vulnerable to getting the virus, even though you've been vaccinated. You're still susceptible. The Mrna virus does not contain any eggs or preservatives or latex. Pfizer is quite similar to the Mrna vaccine too. This one is for use for 16 and above, and it has about a 95% effective. So very, very similar to the Mrna vaccine in clinical trials. The one maybe biggest difference between that and the Mrna vaccine is that the doses are taken 21 days apart. It's also an mRNA vaccine and also does not contain eggs, preservatives, or latex. There are, it can be expected, once you receive the vaccine to have some minor side effects. Just like any other vaccine, there's the chance that you could have some, pain or swelling at the injection site. There's also the, reports of people with maybe a low-grade fever, chills, tiredness, headache, maybe even some mild flu-like symptoms, but they resolve within a couple of days. So the big discussion right now is we know that the supply is still very low in the U.S. and this was expected that once it was approved, it's going to take a while for them to manufacture the vaccine and then also to distribute it in the supply chain. So as we're hearing that the phases are opening up where more people are eligible, we still have to remember that it's not still widely available and that we're still going to have to be patient while the vaccine gets from the manufacturer into the hands of where it needs to go to get out to the public. So that's why the CDC has put together recommendations, and this is based on an independent panel called the ACIP, and they're medical and public health professionals who basically deliberate and decide on who should be prioritized to get the vaccine. And then states can then take those recommendations from the CDC and they can stick with those or they can adopt their own. And that's what we're seeing right now going on. You've probably heard in even the past 24 hours where the allocations for phase 1B have changed very rapidly. And just to start talking about the phases, so we're in phase 1A currently right now. We have been for a few weeks now. That has included our healthcare personnel, our long-term care facility residents, and then also our medical first responders. We've heard from the state that phase 1B is going to be starting very imminently. We've heard January 18th, Monday. Again, it's still in draft. It's not finalized yet, but from what we're hearing, the 3 primary groups are going to be individuals 65 and over, frontline essential workers, and residents and staff of congregate settings. And again, this is a very draft list of frontline essential workers. This could change between now, as I'm speaking right now, and maybe if you're watching this later, it might change since then. But right now, it's believed that the education sector will be part of that essential worker list, manufacturing, grocery store, restaurant, food service, essential retail, agriculture and farm workers, and delivery services. Also, public transit, our drinking water, wastewater, and solid waste workers, food banks, meal delivery to elderly, public health, town clerks, and clergy offering in-person services. So we know right now that within phase 1B, there's even going to be priorities within there. And from what we understand, again, we're waiting for the final decision from the state, but it's believed that our first priority is going to be that population, especially 75 and older, and even the age 65 and older within that group first, for obvious reasons, that those should be prioritized based on how susceptible the elderly are to the disease and can be impacted mostly. So the big question right now is, how can I get the vaccine? I know our office has been flooded with calls, and I'm sure Sal and Russ have been flooded with calls too, ever since the vaccine has been available, from all population sectors of, I want to get the vaccine, how do I get it? So right now, and what's been happening during phase 1A, that if you're an employer, you can go on to the ct.gov/coronavirus. And if you look on this little, this is right from the screen there, it's COVID-19 vaccination distribution plan. If you click on there, there's instructions how, as an employer, you can sign up to be what's called an employer coordinator. And once you register for that, you'll be able to upload the list of your employees to this program called VAMS. You might have heard about this program that's actually been rolled out by the federal government, and it's a way to track and manage the vaccine throughout the country. So it'll be used for uploading your staff to this program, and then this program will then send out an email to your staff, asking them to create, which I think is on my next page, to create an account in VAMS, and then from there, it will then, once they're eligible, it'll allow them to search for an open clinic in their area and make an appointment for a vaccine. The other big question right now is, well, what happens if I'm not employed, or what if I'm in this elderly sector? How do I register for this vaccine? And that is coming very soon. We're not, we haven't been told yet. And from what I understand, as a matter of fact, I just got an email right at the beginning of this call from the state saying that it sounds like that the registration for the elderly will be phone-based, where they'll actually call in and make an appointment. So I'm curious myself, and I'm sure Sal and Russ are too, of how this will roll out. So more to come on that, but I encourage everybody to go to ct.gov/coronavirus, click on the link there, and information will be added on there very soon, moving forward, so people can get information to how to get vaccinated. And this is what the website looks like. And then you can actually go in there, and that's where you can enroll your staff, or if you have any other questions in general about the vaccine. And just the last thing I wanted to mention in here is that, of course, with every, unfortunately, there's always somebody looking to take advantage of a situation. So there's already scams out there. And I just, want to give a quick, couple of points that if you get an email or a phone call from somebody and they're asking you for personal information like your social security number or bank information, no legitimate vaccine site will ever ask you for that. You shouldn't pay to be put on a list or early access or anything like that. Those are not legitimate. And also, oops, that was the end of it. But yeah, let me close this out. The last thing I just want to mention is too that for most cases, insurance will not be required for these. The vaccine is free. Oh, thank you. I don't know who closed that out, but so yeah, it's the last thing I want to mention about that. I'll pass it on now to Sal Neshi.
Morning, everyone. Sal Neshi with the town of Cromwell. I'm the public health coordinator and emergency management director for the town. Larry, Johanna, and the rest of the team at the chamber, thank you for hosting this presentation. Glad to be here and glad to work with my friends at the chamber and my public health colleagues, Kevin and Russ. We talk and see too much of each other on the computers these days, but it's a pleasure to work with you all. So I am going to be brief. I will touch on how we as public health professionals deal with enforcement. Enforcement being how we respond to situations when presented to us that where the public is advising us of issues concerning COVID type concerns or violations out in various sector populations, and how we deal with issues of quarantine and isolation. So for the most part, and speaking for my colleagues, we receive calls on a regular basis from the public related to issues concerning travel, not only for themselves, but for I have a neighbor, I have a friend who's traveling, various questions that come up regarding the travel quarantine and the rules and regulations behind the Connecticut Travel Advisory. I noticed that there was a question in the chat that came up earlier, and Russ addressed it, so thank you. In terms of how we deal with testing out of quarantine when it comes to travel. We also get many concerns and questions regarding quarantine and isolation for individuals who test positive for COVID-19, as well as those individuals who are considered close contacts. Someone who has come in direct contact with a confirmed positive COVID-19 individual vis-a-vis the definition set forth by the CDC inside of 6 feet for 15 minutes over a 24-hour duration. And that's the classic definition of what we consider a close contact. We get a lot of concerns that come up as well. For instance, I have a friend or a family member of mine was determined a close contact. What do? We call those contacts of contacts, and the running joke within public health these days, a contact of a contact is not a contact. So aside from those, we get plenty of calls and concerns regarding sector complaints. Businesses, people are the public is very in tune, very in touch with what is going on out within business, industry, food service, retail. They're concerned. We all need to go to the grocery store. We all need to go to the store. We all need to go to work, and we all want to protect ourselves. So when we see issues, when we see concerns that pop up in these various sectors that we feel threatened in terms of our health and safety, where do we go? Where do we turn to? So public health is usually the first call that's received, and we deal with those in the business and retail sectors, food service, other business settings like office settings and manufacturing, as well as events, both public and private events. In these types of complaints or concerns that are expressed to us, which trigger us to react to these situations and investigate and sometimes enforce, depending on the situation, are usually relative to occupancy, social distancing, the proper use of PPE, such as face coverings, specifically for employees, as well as customers in these types of settings. Hours of operation. Certain sectors are only allowed to operate up until a certain period of time, like food service. So what do you do when we find out with, like for instance, restaurants that are open past a certain hour? COVID case responses. I work at a facility and a coworker of mine tested positive and the supervisor did nothing about it. So we get plenty of those types of calls too. The sale of food with alcohol, as we know in the sector, the DECD sector rules, that's the Department of Economic and Community Development, through virtue of the authority vested in it by the governor's executive orders, food needs to be served with alcohol. And we get plenty of those types of complaints, as well as concerns regarding entertainment and performances that are taking place at food service type establishments. I would say that those are the more popular types of concerns that we receive. And what do? Obviously, we take every one of them seriously. We investigate them, we vet them for legitimacy, and we have various tools in the public health toolbox that have been there for many, many years, as well as those tools that have been given to us as of recent through the executive orders for enforcement. We can do anything where phone calls, letters, citations, calling establishments in for meetings, and all the way up to fines and engaging law enforcement. How do we prefer to operate? So I was brought up in a public health era where education is our primary enforcement tool. Education is what we are charged to do with every act that we take. We are here to educate the public in order to promote public health and safety. So we tend to do what we can to work with establishments to educate them.
I think Sal warned us it's his internet was unstable. Okay, Sal, you're back.
Yeah, thank you. So I think I just got cut off, and hopefully I won't get cut off again. But I think where I got cut off is where I was discussing that education is our primary goal, working with establishments and businesses in various sector populations, as well as private and public, to help strengthen mitigation strategies and help enforce the concept that public health and protection is everyone's business, and we need to work together. And we go out of our way to assure that. Look, we understand that the business community out there is struggling as a result of coronavirus and the demands that are being placed on businesses to conform to the various sector rules. The last thing public health wants to do is come out and issue $10,000 fines, as it is our right to do so. We choose to work with establishments and educate and help them through these challenging times. And that's our primary goal, and that's what we work to strive for. We are asked by the state of Connecticut to report to the state on a regular basis the enforcement actions that we do take and the complaints that do come in. And the DECD also receives complaints through 211 and the various hotlines and emails that you can send to the state. And they are also very good about sending those complaints our way when they receive them. I do feel as though, from the information I've seen, that the complaint rate coming in through 211 in the Department of Economic and Community Development are very low within this area of Middlesex County. And I think that's part and parcel to the awareness of our various sectors, the awareness of the public, and the work that local health is doing to work with sectors in terms of reinforcing and aiding them with mitigation strategies. With that, I'm happy to take any questions regarding enforcement as well. Johanna, back to you.
All right, thank you so much. You guys did an outstanding job as usual. We did have a few, if you noticed, we had a few come into the question and answer that were answered, but I figured I'd just go through them real quick with you. Steve Gorse asked, can I drive to Vermont to ski for the day and then drive home that night? Russ answered, if you are referring to them being exempt from the travel quarantine, then yes. Only if you spend 24 hours or more in an affected state are you then required to comply with the travel quarantine. So I would encourage you all to also check out this. He put a link there, which is fantastic. So please check that out. That goes right to the state's website. A question that just was popped up. What is the protocol if you test positive after receiving the first round of the vaccine? Do you start over with round one or just move on to the second? All right, Sal.
So it's our understanding that provided you are symptom-free and you've completed your 10 days, you can move on to the second shot.
All right, fantastic. We did have a few come into to our email, so let me just go through those real quick. We have HVAC technicians and installers, as well as home heating fuel drivers, have been classified since the onset of COVID as essential. On the advice of the Chamber and Chatham Health, we have submitted our company to be considered for vaccines in phase 1B due to the nature of our contact in customers' homes. As of yesterday, we have not been yet advised that we have been approved and to submit our employer roster. Is there anything that our district can do to advocate for our industry and ensure we can receive vaccines sooner than later?
I guess I'll take a stab at that. So there hasn't been clarification provided by the State Department of Public Health on what they are going to define as frontline essential workers. But they've hinted that it will mean something like the following. If you, by the nature of your work, have to come within 6 feet of either your coworkers or members of the public, and we're on that list, I believe, of essential businesses. That was, I think, developed by the Cybersecurity Infrastructure Agency, which is quite a long list. Then you're probably going to be eligible under phase 1B. It's not surprising that you submitted something a couple of days ago to the DPH-VAM's website and have heard nothing from them, because there are still agencies under phase 1A that have done so and have not heard from the state. So there is a backlog of requests right now, And all I'll say to you is, though it's going to be difficult, be patient. You will likely get access at some point. And I don't know if there's anything you can do to push your way to the front of the line in that sense. But I would expect people who are on that list of essential businesses that the governor used to say you're exempt from the safe stay home order, you're probably going to be included in phase 1B, but I'm not 100% sure.
Great, thank you for that. A few more questions. Has anyone heard if this Connecticut travel restriction exemptions will be modified to include individuals who have received the COVID-19 vaccine?
I'll take
Sal?
that question. Yeah, that falls under enforcement as well. So it's been my experience that the Connecticut travel restrictions and the advisory has been modified several times since its inception to reflect changes in mitigation, changes in through CDC guidance as well as state guidance. So in terms of the travel restrictions changing for individuals who received the COVID-19 vaccine, we haven't gotten any clear or definitive answer as to whether that's going to happen or not. But as Kevin said earlier, by the time this conversation is over, there may be something, who knows? My gut tells me that while we're being told or advising the public that once you get a vaccine and complete the vaccine process, you're still required to wear face coverings. You're still required to quarantine if you're considered a close contact. My gut tells me that you will still be required to quarantine, having come back from another state or a country for more than 24 hours. One of the reasons why I say that, aside from what I just spoke about in terms of what's required after you get the vaccine, is that we need to understand that maybe not all states are using the same mitigation strategies or being as conservative as the state of Connecticut. One of the things that I have found since the spring, since the inception of the coronavirus pandemic, is that Connecticut has been very conservative, has taken a very conservative approach, and in many respects more so than other states in the country. That's why we, as much as we see our case rates are extremely high, they're extremely high for us in terms of how we fare with case rates, infection rates, and even COVID vaccine distribution throughout the country. We fare very well, and that's in whole due to our conservative approach. So based on that history, and my perception is that that will not happen.
Great, thank you. I believe you guys kind of answered this, but let's just reaffirm this. After the required quarantine time, does the person need to get retested again to provide a negative test?
No.
Okay, and if no to the above, then how would you know if the person is contagious or still positive?
Are we talking about quarantine or isolation? We thought somebody's been sick.
I think this is someone who was tested positive, so they were quarantined, and now.
Okay, I think I understand. So once you've been sick with COVID-19, the CDC laboratories have been taking samples of people who are infected with COVID-19 and attempting to culture the virus in laboratories for a long time. They've not been able to culture viable virus from persons who've been sick past 10 days in almost all circumstances. So everybody's had the experience where they get some kind of respiratory infection and they might cough for 2 or 3 weeks afterwards, lingering cough, not feeling great, but certainly not at the peak illness. It's very similar with COVID-19. You're not capable of spreading it at that point. That's the thought, even if you still have some lingering symptoms. If you still got a fever and your symptoms have not improved or you've gotten worse, that's different. Then after 10 days, you should stay in isolation. But there really is no need to get tested again. If you started to feel better, it's been 10 days and you don't have a fever, you're not shedding any virus capable of infecting anyone else.
Great, that's great information. All right, a few more questions. And if anybody has additional questions, you can always use the Q&A and chat down here. Is there a way for senior housing to register, sign up for the vaccine, so when they are included in the phase, they will be contacted?
I can I can try this too, and Sal, if you have anything else to add to it. So I think right now, with senior housing, and it depends, it's going to be, I think, depend on the type of housing it is. So from what I understand, that the governor's office has asked our federally qualified health centers, like the community health center, to assist with doing vaccinations at congregate living sites. So that would probably include a lot of our senior living. So they will be reaching out soon too, especially the places that they've already gone out and done COVID testing. So I think, again, more information will be forthcoming, but that's the plan right now. And I think, you know, we're going to be working hard too as well to go out to sites to do vaccinations on site. We know our long-term care facilities and assisted living facilities were covered under phase 1A, and those have been they've been working with places like CVS and Walgreens to do the testing there, which is probably almost completed by now. But for the places that don't meet that definition of long-term care or assisted, that are just residential facilities, they're going to have to, and it may very likely be that they're going to have to use this telephone-based system to make an appointment.
Okay, great. And you actually answered a second question that they, oh, Sal, you have more to add?
Yes, I'll just add to what Kevin was saying. We have a couple of senior living complexes here in town that have already begun the process of mass vaccination of within their communities, and they're doing that through the pharmacies. So like Kevin was saying, contacting like a CHC or other qualified health center is an option. You know, any provider who's receiving vaccine in abundance like that could partner with these complexes as the two of the ones here within the community of Cromwell are doing. And the other thing is, provided local health continues to receive vaccine from the state in adequate supply, we can assist in that as well.
Fantastic. Great answer. Thank you. Still on the senior housing line of questioning, when they do senior housing, will staff in the facility be able to get the vaccine as well?
So
I don't know.
no, that's one of those, that's a loaded question, because you know, you walk away from the conversation saying Sal said yada yada. But what I will say, and hopefully my colleagues will back me up, is that going back to the premise that if you are an individual who is coming, you know, part of your daily functions, part of your duties, you're coming within 6 feet for more than 15 minutes with a vulnerable population, and it's your job to have to do that. And the rest of your sector, your population in a senior housing complex or assisted living facility, I would say that you would be justified in receiving the vaccine. Okay, I would say that you would be justified. That's my answer. I'll stick to it, and hope my colleagues would agree.
Sounds good to me, Sal.
There you go.
All right. I don't have any other questions here. I don't see any other questions coming up on the chat or in the question and answer. I just want to take an opportunity again to say, we can't thank you guys enough for all you do. Really, you guys are on every division meeting. Whenever we call you with questions, you are always ready and able and willing. For more information on different things on COVID, you can always check out the middlesexchamber.com website. We've got a very comprehensive website that contains a ton of information for you. It's always updated on a regular basis with a lot of information that comes out from the CDC, from the state, from our local health department. So, you know, always use that as a one-stop resource. Thank you. I think Larry wants to close this out, so I'll turn it back over to Larry McHugh. Thanks, guys.
Can I just offer one more thing about vaccines? Because I think it was maybe mentioned by Sal in his comments about the travel and getting the vaccine and not having to quarantine, have to travel if you receive the vaccine. The central issue with any change in recommendations for mitigation strategies around people who've been vaccinated is this. The studies on the efficacy of the vaccine focused on preventing illness. They studied illness in persons who got the vaccine and compared it to illness in persons who did not get the vaccine. They did not study enough whether people had asymptomatic infection, which would have had to involve testing everybody who did and did not get the vaccine. So right now, that's the difference. We know there's a lot of asymptomatic infection with COVID-19. And you can think about the rollout of vaccine in our population now as something like a phase 4 clinical trial. Phase 3 clinical trials are used to demonstrate efficacy and safety. Then they roll it out into a population. At this point, there is a gathering of that information. Do people who get the vaccine become infected? And the only way you can determine that is by testing. So once there is a body of evidence that suggests the vaccine prevents infection, then those individuals who've had the vaccine are likely to be able to do some more things and not worry about, for example, spreading the virus around because they picked it up, didn't get sick because they were vaccinated, but then spread it around to others. That is sort of the missing link with the vaccine, is can you still get the virus and spread it to others even while not getting sick? And we don't want that to happen. We don't want people who are vaccinated to become super spreaders because they think they don't have to wear a mask and they can do all these things and throw caution to the wind. That's the missing link, and it is probably coming at some point, hopefully soon.
Very good information. Real quickly, there's another question that just popped up. Can a property manager advise other residents when someone in the building gets sick?
I would suggest that, if they are going to notify other residents to do not mention the person by name or any identifying information to protect their privacy. If you want, you can say that, that there's maybe somebody in the building who is positive, but I wouldn't go anything past that. I would certainly at that point, make sure that measures are being taken place, of course, to disinfect any common areas of the building, and remind people again to, frequently clean, frequently touch surfaces, and wear their mask while in common hallway areas, and no gathering in any areas in the building.
I like to use the term an individual within our community was tested positive. So you were not singling out a resident or a staff member, like within our schools. We're not singling out a faculty, a staff, a student, or whether it's in a living complex. There are strict HIPAA regulations, and what a property manager is doing, knowing the personal information of the residents like that, I'm not sure. It sounds like the residents divulge this information to their property manager, but there's some privacy issues there. And if they're going to say something within their community, I like to use the term a member or an individual within our community tested positive. That way that puts some anonymity to it.
Excellent answer.
Nice job, Sal. Johanna, there was one question in the list that came in on Friday that wasn't answered about who is doing contact tracing, and when people test positive, are they asked? So what I'll say about contact tracing is that right now, with so much COVID-19 out there in the community, the contact tracing system writ large is under considerable strain, and I'm putting that generously. There is still contact tracing going on. It's a partnership between local health departments and the state health department. There are several hundred state health department contact tracers that make phone calls to individuals who are tested and test positive. Local health departments also have their own staff who are undertaking this effort. About 50% or a little bit under 50% of all people who enter the contact tracing system have at least one phone call made to them. About 90%. Less than 50% are actually reached and have any kind of successful interview. And the degree to which those interviews are thorough and all the close contacts are identified and put in the system and then called themselves, I'd say that is, again, under strain. So I think the message to everybody is, if you test positive for COVID-19, Don't wait for the contact tracing call. Write down everybody you were in close contact with up to 48 hours before you started getting sick or before you got tested if you never were sick, and reach out to them yourself. Anybody you were within 6 feet of for 15 minutes in that window, 48 hours before you started getting sick or since that time, and call them yourself and tell them you got sick. There should be no shame or stigma in getting a respiratory infection to which the entire population is susceptible, the definition of a pandemic. There should be no stigma. Please tell your friends and family and your coworkers. There should be no shame here because contact tracing may happen, but it may happen too late. So let people know.
Great.
Good closing on that. Again, Russ, Kevin, Sal, thank you very much, not only for today, but more importantly, for all the great service that you're giving to all of us in our region. Thank you very much. We're very, very proud of the job that you guys have been doing for the citizens in our region. Thanks again. Again to everyone, just stay safe and make sure every Tuesday you pick up the bulletin that we send out. There's a tremendous amount of material in that dealing with COVID and so many other of the activities going on in Middlesex County. Have a great day, everyone. Thank you very much.
Bye,
Thanks,
everybody.
Larry.
Thanks, guys.
Thanks, Joanna.